is Mina Matsuri. This is a presentation of my final project for SSCI 582, Spatial Databases. My project is titled Better Data, Better Decisions for Healthcare Management, using GIS for measurement and service availability, mapping of Zambia healthcare facilities. So a little background, I live in the country of Zambia. I work as a health researcher and coordinator in the Ministry of Health, and many times we use and compile a lot of data. Much of that data is often paper-based and is inefficient to dissemination and policy development. Healthcare is an area that often is hindered by these paper-based methods. There is a need for efficient collection, analysis, and dissemination of data for providing accurate and reliable data to healthcare policymakers here in Zambia. So having a reliable way of collecting data and then disseminating and showcasing that to the public is actually very, very essential. So the problem I have is that the existing data on healthcare facilities and hospitals and their available services is readily unknown or available to stakeholders. It's not very publicly distributed. So the availability of this information is limited, and it's difficult to assess what potential needs for rural or urban healthcare management are and what resources are available or necessary to establish. So my final project proposes the design of an electronic geodatabase to identify the locations of hospitals and healthcare facilities, as well as their existing services and availability throughout Zambia. This can then help assist with providing better data for policy decision making. The workflow that I used to design my database consisted of using a template, the health data model template, and picking pieces from that template to design my own modified data model, and then from there using that model to identify what data sources that I would need to populate my database. This is the health data model. This is the template that I used to create my health data diagram. As you can see, it's extremely complex, and oftentimes it's focused on very developed health systems. Unlike Zambia, this model is very robust and data rich, so I decided to use the yellow and blue portions and take out things and components that I thought I could use for my own personal database and that I thought would be useful. So these are some of the portions that I took out from the health data model template: health-related activities, health facility types, locations of facilities, services that are available, as well as facility IDs, and facility types in that. Are they public or private? Are they rural or urban? Things like that. So those are things I considered for my database, and those are things I pulled out from the health data diagram template that I used. So this is my health data base model diagram. So there's healthcare services for data, which is linked by foreign and primary keys, facility ID, to hospitals, healthcare facilities. I then created domains under government, private, mission, or NGO domains, and within those domains subtypes for primary, secondary, tertiary level hospitals, if they're urban or rural health posts, or if they're affiliated with like a university, so like a research hospital. I then identified population data, road network data, because some of these hospitals are difficult to access, as well as area boundaries for where these hospitals are located and within which provinces and which districts the hospitals are located. So this was the data that I collected or sought after or went after for my database. Unfortunately, data collection in Zambia was extremely difficult. Unlike the US, where you have huge data stores or data libraries, Zambia doesn't have anything like that. So a lot of my data was manually collected, going to facility and just collecting either points or GPS units that had data on them. I was able to download population density data because I couldn't access the census data directly here in Zambia, and I also downloaded from the internet boundary areas to use in my database. Also, unfortunately, a lot of the data was outdated, so this was not the most efficient database design. I populated my database, and this is what my database catalog looks like within my database with all of the data that I collected.